So the most inferior of the synovial joints that we're going to discuss is the talocrural. So we know crural, we're getting into the ankle joint. So colloquially referred to as the ankle joint. And this is really a true hinge joint. You can see here that the distal ends of the tibia and the fibula, so those medial and lateral malleoli. So here's your medial malleolus and your lateral malleolus of the fibula over here. And then the main tarsal bone of the ankle joint is the talus, which you can see here. And as I said, this is a true hinge joint. So we have flexion and extension, but it's in this particular joint, we refer to this as dorsiflexion and plantar flexion. So you can see dorsiflexion pointing your toes up, plantar flexion standing on your tiptoes. Let's look at it here. You can see you have a smaller range of motion with dorsiflexion as opposed to plantar flexion. But when you are plantar flexing, this is quite a bit less stable than dorsiflexion. Now there are two other joints in this region that I want you to be aware of, but we're not going to go into a tremendous amount of detail. This is the subtalar. All right, so the subtalar is going to be between the calcaneus, or your heel bone, and your talus. All right, so that's subtalar. And then the other one I want you to be aware of is the transverse tarsal joint, and this is going to be between the calcaneus and the talus together and the rest of your tarsal bones. All right, so these two joints are going to allow for this other movement that I want, or other suite of movements I want you to understand, which are going to be inversion and eversion. All right, so let's look here. Inversion, the sole of your foot is going to be pointing medially. Eversion, the sole of your foot is going to be facing laterally. Now the reason that I want to discuss these two movements with dorsiflexion and plantar flexion is that you very rarely can do these types of movements separately. So say if you are plantar flexing, you typically will have some degree of eversion or inversion, and vice versa. So these movements often occur together, even though the particular joints are different. All right, so the deltoid ligaments are going to be on the medial side, as you can see. This is referred to as the medial ligaments, and it's important to note that this is a suite of 4 ligaments. These are considerably stronger and more robust than what you're going to have on the lateral side. And one thing I want to note, and that what's going to be different than the lateral side, all these ligaments are going to have an attachment on this medial malleolus of the tibia. But importantly, these ligaments not only attach on the medial malleolus, but the fibers kind of intertwine to really have a more solid attachment there. So not only are attaching to the bone, but kind of intertwining with one another. Now these particular suite of ligaments is important in terms of stabilizing the joint during eversion. Okay, so let's remember eversion, the sole of your foot moving laterally, okay, so facing laterally. And if you think about how the range of motion for eversion as compared to inversion, that makes sense that these are going to be the stronger of the two. Now you can see here that it's a bit more hodgepodge on the lateral side of the ankle joint. So you have 3 separate ligaments here. They're all attaching on the lateral malleolus as well, but those fibers don't actually intertwine. So not quite as strong on this side. And this really plays a role in terms of stabilizing during inversion. So invert your foot. Remember the sole of your foot moving medially. You think you can do that quite a bit more than eversion. So if you think about kind of your foot getting stuck and you're inverting your foot too much, it'll cause these particular ligaments to be damaged. So this is when you think of an ankle sprain or injury to the ankle. Typically it's happening on this lateral side. This is the last of the synovial joints that we're going to discuss. We're going to move on to the actual skeletal muscle that's going to contract and allow for these joints to move.